We had a request from one of our followers regarding a disease state called porphyria. It is a rare disorder caused by a natural buildup of porphyrins, and what happens is porphyrins are actually a good thing. They're needed to make up heme, which is part of hemoglobin. And what the heme does is it's in red blood cells and it carries oxygen to tissues and organs. It also helps carry medications or drugs and toxins out of the system, and as well as circulate hormones too. So porphyrins are not a bad thing in normal levels, but what happens in porphyria is that actually you have too much of them, because 8 different enzymes are needed to break down the porphyrins into heme. And what happens is the majority of cases are those that are hereditary. So the enzymes are not there or they're not functioning correctly, and that is where you get the buildup of the porphyrins that can cause major issues in the central nervous system and the skin. There are 2 general types. One is the acute type. It is very rapid acting, and it mainly will affect the central nervous system. The cutaneous is in the skin. It's the second type. Then there are other porphyrias that can actually affect both the skin and central nervous system. However, they're not as much as common as the other 2. Again, as I said, usually they are inherited. In the acute, symptoms will last from hours to days, and it can be intermittent. You may have symptoms for a few days and then not see them for a couple of months, and then it comes back. With those symptoms, you can see severe pain in the back, legs, chest, and belly area. You can also see nausea and vomiting that are severe, muscle aches, tingling in the toes and fingers and hair area too as well. You can also see red or brown urine, constipation. Because you're dealing with the central nervous system, you can see anxiety, confusion, hallucinations, seizures, an increase in your blood pressure, breathing issues, and heart palpitations. Now, the cutaneous is not as severe, but symptoms that you experience there are due to artificial light or reactions with the sun. So if you go out in the sun, you're going to be triggering those symptoms. And with that, you can see itch, burning pain, swelling, redness. Blisters can occur that can create problems when they pop because you'll be prone to skin infections. Thinning of the skin, color changes in the skin. So if you're a light color, you could see dark color just in the area exposed to the light or the sun. Hair growth and natural hair growth, again, just in areas that have been exposed to the light or the sun, and red or brown urine again. One that you will also see, another one that's not as common as the acute or cutaneous, is PCT, or Porphyria cutanea tarda. That one is not hereditary. It can be triggered by smoking, excessive alcohol use, viral infection, generally severe. So you're looking at hepatitis C, HIV. Also, it can be triggered by an excessive amount of iron in your blood, as well as hormonal changes that will fall in line with a menstrual cycle, the monthly menstrual cycle. Now, triggers that can happen with all of these: sun can be a trigger, smoking, fasting or severe diet. So if you're on a crash diet, that can trigger it. Physical or emotional stress can trigger it. Illicit drug use, and then certain medications like birth control, sedatives, phenobarbital. Those all can trigger it as well. Again, excessive alcohol use can also be a trigger with it, And again, hormonal changes in line with your monthly menstrual cycles can do it. Now, with the acute porphyria, that can actually be life-threatening because of the CNS effects. So if you see a sudden increase in your blood pressure that is way higher than it should be, or the palpitations, you need to get into the ER or the doctor right away. What they will do for treatment on that will be IV fluids, especially with dextrose, to help increase your carbohydrate load, to help get those things back under control. The other thing as far as treatments with that, there is a drug called Givlarli, which is a monthly shot. And with that monthly shot, it decreases the amount of monthly attacks that you can get with that. Other things that they will do to help treat that will be monthly blood draws to see where your level of iron is at. They may actually draw blood out to decrease the amount of iron in your bloodstream. As far as cutaneous treatment, what they can do with that is you'll take vitamin D supplementation because you're not getting the natural vitamin D that you do by going out in the sun because, hello, it's a trigger. Something else, a medication that they can use, it's a normal medication, not a very expensive one, is Plaquenil or hydroxychloroquine. And what it does, it actually absorbs the porphyrins to help remove them from your system that way. So the hydroxychloroquine binds to the porphyrin, goes through its metabolism, and it will be eliminated from your body with the porphyrins with it to help lower those levels. There is no cure for it, just treatments.